Anesthesia and Euthanasia in laboratory animals. What is anesthesia? We already know it's a state of unconsciousness induced in an animal. Anesthesia means without sensation, and stands for without, anestos means sensation. What is the purpose of anesthesia? The purpose is to bring the animal in a state where you can perform an operation without the animal suffering. The basic elements of general anesthesia include reversibility, it should be reversible, loss of awareness, that is unconsciousness, conscious sensitivity to pain, that is analgesia, and muscle relaxation, diminished motor response to noxious stimulation. The anesthesia ensures humane handling of animals and safety of personnel. Choice of anesthesia should be like that. It should have minimal interference on study. The choice depends on the immobilization of the animal, nature of the procedure, and duration of the procedure. Anesthesia can affect some physiological parameters such as pressure, blood oxygen saturation, cerebral blood flow, and many other factors that may affect the post-operative follow-up. The majority of anesthetic agents decrease the cerebral metabolism, and they often affect the neurotransmission of nerve impulses, for which the body temperature and other physiological parameters should be monitored during anesthesia. The factors to be considered before anesthesia include nutrition of the animal, disease, parasitic load, infection, stress, pregnancy, and lactation. Inspection of the animal should be done before anesthesia. Check animals before anesthetizing them. Evaluate the physical condition of the animals to ensure the absence of any disease condition that might interfere, that might compromise the animal's health during anesthesia. And do not anesthetize sick animals. They are unsuitable for experiments anyway. Pay attention to symptoms of infections. How to fast before anesthesia? Take away food but not water. The smaller species, there is faster metabolism, and shorter fasting should be there. No fasting is required for mouse. For performing abdominal procedures in rat, fast for 6 hours, and in case of guinea pigs and rabbits, fasting for 6 hours duration is sufficient. Premedication is done with the help of atropine, as it produces no saliva, no vagal reflexes, less gut motility. The dose in rodents is 0.05 mg per kilogram body weight. In rabbit, 1 to 3 mg per kilogram body weight. About 30 minutes before anesthesia, it should be administered. Why there is a need for pre-anesthetic medication? Because it reduces fear, it provides sedation, stress-free induction of anesthesia, and reduce the amount of other anesthetic agents required, so decreasing undesirable side effects of these agents, provides smoother induction of anesthesia, provides smoother recovery from anesthesia, and reduce the volume of salivary and bronchial secretions. The pre-anesthetic drugs can be classified in these 3 categories. Anticholinergic drugs, for example, atropine, it reduces the salivation and also bradycardia. Tranquilizers and sedatives, for example, aceclomazine, xylazine. Aceclomazine works to calm the animal and facilitates the restraint. Xylazine depresses the central nervous system. Opioids is the 3rd category. Example is methadone. It relieves the pain. One anesthetic agent or a combination of anesthetic agent may be used. The advantage of using a combination of several drugs is that it can minimize the side effects of each drug since it is given in a smaller amount. The disadvantage of using a combination is that many different side effects may occur which can interfere with the research protocol. The different types of anesthesia can be divided in these 3 categories. General anesthesia, it is inhalational and injectable, 2 types, and second is regional anesthesia, third is local anesthesia. Just for refreshing our knowledge, there are 4 stages of general anesthesia, we already know. Stage 1 is also known as stage of analgesia or voluntary movement. Duration is from onset of administration to the loss of consciousness. Stage 2, the stage of delirium or involuntary movement. Duration is from loss of consciousness to onset of regular pattern of breathing. Stage 3 is the stage of surgical anesthesia, and it is characterized by unconsciousness, a progressive depression of cardiopulmonary function, a progressive depression of reflexes, including vomiting and swallowing reflexes, and muscular relaxation. It is divided into planes 1 through 4, where plane 1 is light, planes 2 and 3 are medium, and plane 4 is deep anesthesia. The Stage 4 is characterized by extreme CNS depression. Death ensues quickly unless resuscitative steps are taken. Inhalation anesthesia, the choice of apparatus for small animals, the use of anesthetic induction chamber is there. It is used for animals that weighs less than 1 kilogram of body weight. Opaque face mask, endotracheal tubes can be used. For larger animals, endotracheal tubes are used. The agents that may be used are isoflurane. It is most safe and common in humans. Sevoflurane, very fast induction is there. Desflurane only for humans, and fluorane, very fast induction is there. Halothane, it is commonly used in veterinary practice. Methoxyflurane, it produces good analgesia. We will discuss these one by one. Halothane is the most common inhalation compound, does not evaporate at room temperature, and the toxicity may cause liver damage. Is cheap, approximately rupees 1200 to 50 milliliter. Produces good clinical anesthesia with guidance. Isoflurane, reasonable research anesthesia with good guidance. More expensive than halothane, and it requires vaporizer. Ether and chloroform, they evaporate to moderate concentrations at room temperature. Ether explodes. Chloroform is liver toxic and suspected carcinogen. Carbon dioxide is useful for 1 to 2 minutes procedure, but it is no longer used for rats and mice now. And in case of anesthesia with carbon dioxide, when the writing reflex disappears, like stepping, hopping, then the animal is moved to mouth cone with 50% carbon dioxide and 50% oxygen. These are the types of anesthetic equipment. Induction chamber is particularly good for induction of anesthesia in small animals such as mice, rats, guinea pigs, etc. And but the disadvantage is large amount of waste gas is there, and it is not possible to assist ventilation artificially. This photograph is showing the complete inhalation set. This is anesthetization of a rat in chamber. The rat is inside the chamber filled with gas. The rat will be unconscious relatively fast. The rat is taken out and then put in the mask. Maintaining normal temperature is important. These are the devices for maintaining the temperature, for recording the temperature. This is rodent respirator, and this is the recorder for small animals. Injectable anesthetics include barbiturates, hypnotics, cyclohexamines, also known as dissociative anesthetics, steroids, alpha-2 agonists, sedatives and tranquilizers, and local anesthetics. Barbiturates, we will discuss these one by one. Barbiturates are also known as sleeping medicine. They have the ability to produce either sedation or a deeper hypnotic state. Short-acting barbiturates, for example, pentobarbital, or ultra-short-acting barbiturate, for example, thiopental are the examples. Barbiturates should not be used alone for survival procedures because they produce no analgesia and many hangovers will be there. Hypnotics, these are the examples. Chloral hydrate is very safe for light anesthesia, produces poor analgesia, very little effect on the cardiovascular system. Alpha chlorelose, very long lasting sleep, very little effect on the cardiovascular system, poor analgesia is there. Do not use it for survival procedures. Urethane, it acts as carcinogen, very long lasting sleep is there, very little effect on cardiovascular system, some analgesia is there, poor effect on neurotransmission, and do not use it for survival procedures. Metomidate in combination with etomidate, they produce short lasting sleep, potentially useful for long term anesthesia. They have very little effect on cardiovascular system and produces poor analgesia. Propofol, very short lasting sleep, fast and non-problematic recovery is there, poor analgesia, suitable for induction and infusion. Tribromomethadone produces short lasting sleep, popular for mice. Cyclohexamines, also called as dissociative anesthetics. By these, the animal loses its sensation of its environment. They have open eyes, increased muscle tension, movement in spite of analgesia, and no relaxation of pharynx. The examples are ketamine and tilatamine. They produce good analgesia, safe, will show increased blood pressure. And then alpha-2 adrenergic agonists, they are sedative, analgesic, and skeletal muscle relaxants. They are not anesthetics, nor are they tranquilizers in the strictest sense. Examples are xylazine, tetrametine and medetomidine. Then another category is sedatives and tranquilizers. They help in mental calming. There is decreased response to environmental stimuli. They do not produce sleep, analgesia or anesthesia. Tranquilizers or neuroleptics or psychotropic agents. Two categories are there, phenothiazines and butyrophenol derivatives. Phenothiazine, the examples are chlorpromazine, aceclomazine. Butyrophenol derivatives are droperidol, azaperone, fluonisone. And another category is sedatives. Under these, benzodiazepines are there. Examples are diazepam and midazolam. Local anesthesia. Local anesthetics block nerve conduction when applied locally. Can produce localized, regional or topical analgesia. And examples are, first is lidocaine. The effect sets in fast and slowly disappears in 1 to 2 hours. Mepivacaine is just like lidocaine, but the effect holds for a longer time. Bupivacaine, 3 to 4 times as potent as lidocaine, and it takes longer time before it works, and then it works for a longer time. Now we come to the assessment of anesthetic depth. In case of mouse, monitoring of respiratory rate and checking the corneal reflex, tail pinch, pedal withdrawal reflex are there, and pedal withdrawal reflex is best for assessing the anesthetic depth. Rat, respiratory rate, tail pinch, pedal reflex, ear pinch. Ear pinch is best in case of rat. In case of guinea pig, palpebral reflex and ear pinch are done. Ear pinch is best than rabbit. In case of light surgical anesthesia, there is loss of pedal withdrawal reflex. In case of medium depth of surgical anesthesia, the palpebral reflex and ear pinch are lost. And then corneal reflex, it is lost in case of dangerously deep anesthesia. Postoperative care is very important. The temperature of the animal should be maintained by using infrared light bulb, insulation. Fluid therapy should be done intraperitoneally or subcutaneously as boluses. Air humidification should be there. And this photograph is showing the recovery chamber, and this is insulated recovering rat. Now the techniques to use in anesthesia: accurate body weight should be recorded, taking care for minimizing the stress. Withhold feed. The duration of fasting for large animals is 12 hours. For small animals, 2 hours. Rodents and rabbits not necessary. After this anesthesia, intubation is done. Assist respiration. Monitoring of body temperature is important, and maintaining it to the normal level. The body temperature can be maintained. The body temperature falls during anesthesia, so maintain the body temperature with the help of blankets, drapes, circulating water, heating pads, limited taking of air, warm fluids. IV catheters should be placed for administration of drugs and fluids. And monitoring of reflexes will be done. Palpebral reflex in case of light anesthesia. If they are blinking, means the animal is in light anesthesia. Corneal reflex stops blinking if the animal is in too deep or dead. Toe pinch, the toe pulls away in case of light anesthesia as the animal is feeling pain. Muscle tone should be checked. The tone of the jaw and anal sphincter muscles is relaxed during anesthesia. Monitor the cardiovascular function, heart rate, pulse rate, blood pressure, ECG. The depth of respiration and the rate of respiration should be monitored. Increase in the depth of respiration and decrease in respiration rate signify the anesthesia. Supplemental fluids should be provided to correct for blood loss of dehydration. It should be 3 times the volume of blood lost. Can be given intravenously. Other routes to be given are intraperitoneal or subcutaneous. And fluids during anesthesia, the dose rate is 10 ml per kilogram body weight per hour. There are some anesthetic considerations for specific species. In case of rabbits, easily frightened, difficult to intubate. In dorsal recumbency, abdominal viscera may interfere with diaphragm movement and venous return. Guinea pigs are difficult to intubate because of pharyngeal anatomy. Soft palate is continuous with the base of tongue, hence the glottis cannot be visualized. large cecum which contains 65% of the gastrointestinal contents. Now, inhalation versus injectable anesthesia. In case of inhalation anesthesia, there is a need for anesthetic machines and technical competence is there. Need for mechanical ventilation. Pregnant women cannot work with it. Can be used for hours, and rapid induction and recovery is there. Easy to control the anesthetic level. In case of anesthesia by injection, it is simple. No demands on equipment. Easy induction. Allowing the patient to pass quietly into surgical anesthesia. Depth of anesthesia is less readily controlled. Prolonged duration of anesthesia calls for repeated injections or continuous infusion through intravenous access. When a drug is injected, it has to be metabolized or excreted by the kidney. It is therefore easy to inject and overdose. What is analgesia? You already know it means without pain. An stands for without, algios means pain. There is some difference between anesthesia and analgesia. Anesthesia means controlled reversible serious depression, unconsciousness, diminished response to sensory stimuli and thereby loss of sense of pain, muscle relaxation. And analgesia is reduced or cessation of reversible pain perception, can be local or regional or universal. Why should pain be avoided? These are the reasons. Because of ethics, the ethical guidelines require that the procedures involving the animals should be conducted in a manner that avoids or minimizes distress, discomfort or pain to the animal. The post-operative pain management influences the quality of patient care as well as surgical outcome, and fast healing is also there by minimizing the pain. How to make sure the animal doesn't feel pain? By using proper technique with minimal tissue damage, work in hygienic conditions, minimize other discomforts as fear, dehydration, light, constipation, loud noises or voices, other animals, etc. Plan your use of analgesia and use them correct. Prevents the development of pain. If indicated, use local anesthesia. Watch over the animal and take action in time. How painful are different operations and for how long? The assessment of pain is based on expectations, physiological parameters and behavioral responses. A simple abdominal procedure is painful for 6 to 8 hours. Most operations will be painful for a couple of days. How can I see if an animal is in pain? Many animals suffer quietly, but there are some signs by which we can assess that the animal is in pain, like changes in posture, facial expression, bristle fur, guarding or protecting a limb, self-mutilation, dilated pupils, salivation, muscle rigidity or weakness, and changes in sleeping, eating, drinking, body weight or appearance, change in appearance or elimination patterns also suggest pain. In rats, chromodactyly, red means red colored tears will be there. Analgesis, the categories are opioids. Opioids are used for treating moderate to severe pain or penetration with surgery. There are many different opioids. And non-steroidal anti-inflammatory drugs, they are effective against pain of low to moderate intensity. There are many groups of NSAIDs. Opioids and NSAIDs can be combined and they give synergetic effect. The examples of opioids: buprenorphine, 25 times as potent as morphine, but the maximum analgesic effect is less. It has a ceiling effect. Bigger doses doesn't give more pain relief, and is very popular because of its long efficiency, approximately 8 hours. Opioids should not be given after operation until the animal's respiration is reliable. Non-steroidal anti-inflammatory drug like caprofen is the most commonly used non-steroidal anti-inflammatory drug for perioperative analgesia and is often effective for controlling post-operative pain. It is suitable for administration once daily orally or subcutaneously. It is against moderate pain and it is administered before or during or right after the surgery. These are the anaesthetic and euthanizing doses of different agents: carbon monoxide, carbon dioxide, nitrogen and argon. They are used as for performing the euthanasia. The dose for carbon monoxide is 3%, carbon dioxide greater than 70%, nitrogen more than 60%, argon again more than 60%. Halogen, the anesthetic dose is 2%, and euthanasia dose is 4% for a duration of 90 seconds. Isoflurane 1% is the anesthetic dose. 3% is euthanasia dose. Pentobarbital 30 mg per kg body weight is anesthetic dose, and euthanasia dose is 90 to 200 milligram per kilogram body weight. Thiopentol sodium is 12 to 24 milligram per kilogram body weight, and euthanasia dose is 100 to 150 milligram per kilogram body weight. Oral hydrate is used as euthanasia, and the euthanizing dose is 900 to 1200 milligram per kilogram body weight. Now, parenteral anesthesia of mice. The agents used are pentobarbital, trichromoethanol, metomidate in combination with fentanyl, ketamine in combination with xylazine. Their doses are given and the duration of surgical anesthesia they are given in this table. Parenteral anesthesia for rats. The agents used as pentobarbital. They are different dose, 30 milligram per kilogram body weight, metodonium 40 milligram per kilogram body weight. The onset of action is in 5 minutes and duration is 90 minutes and 120 minutes. Ketamine in combination with xylazine, different dose rate combination. Onset is 5 minutes, 2 minutes, and duration is 80 minutes and 150 minutes. Ketamine is combination with betomidine, 75 milligram per kilogram body weight ketamine plus 0.5 milligram per kilogram body weight metomidine. The duration of anesthesia is 20 to 30 minutes. And these are parenteral anesthesia of rabbits. These are ketamine xylazine combination, different dose combinations are there. Duration of surgical anesthesia, ketamine in combination with xylazine isochromazine, ketamine xylazine budesonide combination, and pentobarbital. Pentobarbital induced with 10 milligram per milliliter intravenously and administered increments of 2 to 10 milligram until a satisfactory level of anesthesia is reached. The duration of surgical anesthesia is 20 to 30 minutes. And parenteral anesthesia of guinea pigs. The agents used are ketamine in combination with xylazine. Different dose rates are there. Different 30 milligram per kilogram body weight ketamine, and here 44 milligram per kilogram body weight ketamine. And it has an effect in duration of anesthesia. And pentobarbital in combination with fentanyl and propionidol. Pentobarbital alone. Likewise, this is parenteral anesthesia for dogs. The agents used are ketamine in combination with xylazine, propofol, thiopentol, and pentobarbital. Their dose and duration are given in this table. Parenteral anesthesia of macaques. Ketamine in combination with xylazine, thiopentol, pentobarbital. Their dose rates, duration. There are some anesthetic emergency drugs. First is doxaprom. The dose is 1 to 5 milligram per kilogram body weight intravenously, and it is 10 times in farm animals. Indications are it acts as respiratory stimulant for complete respiratory arrest only, used with CPR. Furosemide 2 milligram per kilogram body weight intravenously or intramuscularly. It is administered. Indications are for pulmonary edema, administered as needed. Naloxone 0.04 milligram per kilogram body weight intravenously, and it is given for reversal of narcotic sedation or respiratory depression. Hon'ble 0.1 to 0.15 milligram per kilogram body weight intravenously. It is given for reversal of xylazine or metomidine sedation. Then atropine, the dose is 0.02 to 0.04 milligram per kilogram body weight intravenously, given for bradycardia. Epinephrine 1:1000 concentration, 0.1 milligram per kilogram body weight intravenously, intratracheal, intracardiac, and intramuscular can be administered for cardiac arrest only. Lidocaine 2 milligram per kilogram body weight intravenously, and the dose in cats is 0.5 milligram per kilogram body weight. It is given for diagnosed ventricular tachycardia only, administered to effect and monitor. Now we come to the euthanasia of laboratory animals. What is euthanasia? We already know it means good death. U stands for good and T means death. There are some reasons for performing euthanasia. The euthanasia is required at the end of an experiment or when there might be continuing adverse effect. Euthanasia is done to provide blood and other tissues for scientific purposes. When levels of pain, distress, and suffering are likely to exceed the designated level, the euthanasia can be performed. Where the health or welfare of the animals are ground for concern, when they are no longer suitable for breeding, unwanted stock or those with unsuitable characteristics, for example, type or sex are not needed, then euthanasia may be performed. These are the general considerations. The euthanizing agent should have the ability to induce loss of consciousness and death without causing pain, distress, anxiety. The choice of euthanizing agents depends on the time required to induce loss of consciousness, reliability, safety of personnel, and irreversibility. Their compatibility with requirement and purpose, emotional effect on observers or operators, compatibility with subsequent evaluation, examination or use of tissue, compatibility with species, age, and health status. These are the acceptable methods of euthanasia. First category is chemical method. The anesthetics are used in overdose as euthanasia agents. Inhalation agents, for example, inhalation agents, the gases, carbon dioxide, carbon monoxide, nitrogen and argon, they are used for euthanasia. Volatile agents, halothane, isoflurane, methoxyflurane, and injectable agents, barbiturates. Second category is physical methods. They cause immediate loss of consciousness through physical trauma to the brain, shooting, concussion or stunning, electrical stunning, cervical dislocation, decapitation, exsanguination, and maceration are the types of physical methods. Then carbon dioxide, we will discuss these one by one. Carbon dioxide is mainly used in rodents. It induces deep surgical anesthesia in 1 minute. The carbon dioxide concentration of greater than 70% with a 5-minute exposure is optimum. Carbon dioxide stimulates the respiratory center, which may cause anxiety and distress in the animal as well as being aesthetically unpleasant for the observer. The advantages include it acts as rapid depressant, analgesic and anesthetic, inexpensive, non-explosive, non-flammable, readily available in compressed cylinders, and no tissue residues. Disadvantages include heavier than air, incomplete filling of a chamber may permit animals to climb or raise their heads above the higher concentration and avoid exposure. High concentrations may be distressful to the animals. These photos, this carbon dioxide chamber is being shown in these. Carbon monoxide is a colorless, odorless gas that is non-flammable and non-explosive unless concentrations exceed 10%. It combines with hemoglobin to form carboxyhemoglobin and blocks uptake of oxygen by erythrocytes, leading to fatal hypoxemia. Nitrogen organ, colorless and odorless gas, inert, non-flammable, and non-explosive. Euthanasia is induced by placing the animal in a closed container that has been filled with nitrogen or argon, or into which the gas is then rapidly introduced. Death occurs by hypoxia. Halothane, which is a volatile virulent anesthetic agent. Overdoses can be used to kill an animal. Halothane must be used in closed chambers for small animals. Advantages are easily achieve high vapor levels in closed containers, quick action, relatively non-irritant to inhale. Disadvantages are human health risk on exposure to vapors. Isoflurane reduces pain sensitivity, that is produces analgesia and relaxes muscle. Very good but very expensive. Chloroform is not acceptable for either anesthesia or euthanasia as it is very toxic to many species of mice. Additionally, this compound has been shown to be carcinogenic. Ether is irritating, flammable and explosive and should not be used in animal rooms. In addition, animals euthanized with ether must be left in a fume hood for several hours so that the carcasses are not explosive when disposed of. Injectable agents. The injectable agents are the most rapid and reliable method of performing euthanasia. It is the most desirable method when it can be performed without causing fear or distress in the animal. Aggressive, fearful, wild or feral animals should be sedated or given a non-paralytic immobilizing agent prior to intravenous administration of the euthanasia agent. The advantages of barbiturate derivatives are: the primary advantage of barbiturates is speed of action. This effect depends on the dose, concentration, route and rate of the injection. Barbiturates induce euthanasia smoothly with minimal discomfort to the animal. They are less expensive than many other euthanasia agents. Disadvantages include intravenous injection is necessary for best results and requires trained personnel. Each animal must be restrained. Anesthetically objectionable terminal gas may occur in unconscious animals. These drugs tend to persist in the carcass and may cause sedation or even death of animals that consume the body. Pentobarbital, it is short-acting barbiturate. It is being used in humans for the treatment of seizures and operative sedation. It is also approved as a short-term hypnotic. In veterinary medicine, sodium pentobarbital is used as anesthetic agent. Chloral hydrate depresses the cerebrum slowly. Therefore, restraint may be a problem for some animals. Death is caused by hypoxemia, resulting from progressive depression of the respiratory center and may be preceded by gastric muscle spasm and vocalization. Chloral hydrate is conditionally acceptable for euthanasia of large animals only when administered intravenously and only after sedation to decrease the undesirable side effects. Chloral hydrate is not acceptable for dogs, cats and other small animals because of the side effects. Thiapental sodium. Sodium thiapental is better known as sodium pentothal, thiapental or thiapental sodium. It's an intravenous rapid onset, ultra short acting barbiturate under anesthetic. These are the euthanizing doses of different agents we have already covered in our previous slide. Physical methods include decapitation, cervical dislocation, microwave irradiation, captive bone, gunshot, electrocution, exsanguination, maceration, stunning. Decapitation means removal of head. It is done by use of guillotine. It should be close to the head and it is a sharp instrument. In rodents and small rabbits, this method is used. Cervical dislocation in mice, young rats and guinea pigs, neonatal rabbits. This method is used to develop the brain stem. These photographs are showing the cervical dislocation in rat. This is normal mouse, and this is following cervical dislocation. Note the cervical thoracic separation. Microwave irradiation. Euthanasia by microwave irradiation with the help of focused beam instrument is performed by the neurobiologist to fix the brain metabolite without losing the anatomic integrity of the brain tissue. And special equipment is needed in this. The death or unconsciousness occurs within less than a second. The instrument in this only the size of mice and rats it can be performed in these animals with the currently available equipment. Then captive boat or bubble gunshot is mainly used in large animals. These are the acceptable methods of euthanasia. In rodents, acceptable methods are inhaled anesthetics with carbon monoxide, carbon dioxide, microwave irradiation, barbiturates. In rabbits, inhaled anesthetics. The acceptable are carbon monoxide, carbon dioxide and barbiturates. And conditionally acceptable nitrogen, organ, cervical dislocation and decapitation. Nitrogen and organ, cervical dislocation, decapitation, pain-treating captive mode in case of rabbits. Regardless of the method of euthanasia used, the confirmation of death is important before the disposal of animals. The recognition and confirmation of death can be done by observing the cessation of heartbeat, cessation of respiration, absence of reflexes. The corneal reflex is lost in case of death. Rigor mortis is present. Body temperature is below 35 degrees centigrade in case of rodents. These are the references for making this presentation. This is all about anesthesia and euthanasia and lab animals.